Swelling is expected and very common after a major surgery such as a liposuction or a tummy tuck. That swelling though can cause discomfort and aching and pain. But by getting the swelling down, that can significantly help speed up the healing and recovery process. My name is Kelly. I am a physical therapist as well as a certified lymphedema therapist. And today in this video, I'm going to share the best types of compression and ways to help decrease swelling in the abdomen and pelvic regions after these surgeries. I have created another video on self-lymphatic drainage to this area after a liposuction or tummy tuck, which I will link up above. And for other content related to this, be sure to subscribe down below. Before we get into anything further, just make sure that you check with your surgery team or your medical team for any clearance before trying any of this. We want to make sure that after surgery, everyone is following their own protocols and making sure that everything is fully healed before trying anything further. There are 4 main ways to help decrease swelling in the abdomen after surgery. They are compression, exercise, deep breathing, and lymphatic drainage. One of the most effective ways to help decrease swelling in any part of the body is with compression. Compression will give a gentle pressure around a swollen area, which will help push that fluid out of the area that is congested. And not only does it help move the fluid, but it also can help avoid swelling from occurring. And so when we look at what type of compression is the best for this situation in the abdomen after surgery, we really have 2 different options. We have the high medical grade specialized compression, and we have the basic standard off the shelf option. So we're going to talk about that first. When we think about what is the basic option that someone can try that still really does work well for a lot of people, we're thinking about shapewear. And we talk about shapewear, for most people, the first name that comes to mind is Spanx. And yes, Spanx has a lot of great options for shapewear that do work well, but they are a little bit more expensive. So just know that there are a lot of different brands out there now. This area has been booming and growing like crazy, and so you can find them just about anywhere. I have a lot of people just go to Target because they are cheap, but they are still high quality. They even do carry some Spanx versions there. And so what we're looking for is, it's preference at this point or what someone needs, but there are either the brief options and then there are the shorts, so that go down and cover the thighs. It really depends on what kind of surgery someone had, what was affected, what's swelling, and what's comfortable. And that part is just depending on you, the individual, as well as what your therapist recommends for you. But what we want to look for is we want it to come really high. We don't want it to come too low that will tourniquet or dig in or roll down. So coming up high keeps it nice and smooth. We want to make sure that the compression or the fabric is uniform throughout, meaning not just a pocket of compression in the front and a pocket in the back, because some do that. We want to try to have the compression the same all the way around and throughout, so that we're not having pockets of swelling show up. We would try to look for the least amount of seams as possible, because they can cause a tourniquet or dig in a little bit too much. And we just want to make sure that it also fits well and it's comfortable. If it's too tight, someone has trouble breathing, it digs on any areas, makes the area tender, that's just too tight. It should be a gentle compression. But like I said before, the type and style of whether it's a long shorts or the brief style, that's dependent on the person. But I will put some links down below, so some of my favorite ones that I tend to refer my patients to, that again are some of the cheaper options but still are really high quality and tend to work well for that temporary swelling that someone might have. The other option, like I talked about before, is more the medical grade or specialized compression. So one of the main ones is Juzo's compression short or biker short. There are some other name brands that I will link down below, but they are meant for usually lymphedema, which is a more chronic swelling that lingers for a lot longer, can be more severe, and these are thicker, stronger fabrics. And so they are going to give good compression. They're almost always going to be uniform, the correct height, no seams, good length. All of that's really teed up already because this is what they're meant for. but it's going to depend on how much compression someone needs and how severe the swelling is. And so I will link some of those medical grade compression garments that I also approve and like down below as well. And you can check all of those out further and find what works best for you. Compression is typically worn just during the day. That may vary based on the surgery and the type of swelling, but again, a therapist in your local area can help you determine what's best for you. Along with compression, deep breathing can also help stimulate and speed up the process to decrease swelling. Deep breathing does stimulate the lymph nodes that are deep in the abdomen. All of the fluid from the lower body have to go through these deep lymph nodes and deep lymph vessels to get out of that area, back towards the heart, and then out of the body. So by stimulating them with deep breathing, that can help speed up that process and get that fluid moving. So how do we do that? With the compression shorts on, or by placing the hand on the abdomen, gently pressing in. We want to take a deep breath, feeling our belly expand into our hand or those shorts, but making sure that we're resisting that expansion. Then we'll do that 4 or 5 times. So big breath in, feel that belly expand into the hand, and breath out. And you can move around to different areas, breath in and out. And then I'll move down, breath in and out. And then repeating that a couple more times. Breath in and out. And one more, breath in and out. And you can do those nice and slow, but doing 4 to 5 breaths spread out throughout the day, just making sure that we're moving this lymphatic fluid, moving this fluid and this swelling, that can also speed up the process. So along with the compression and the deep breathing, the other way to help speed up swelling reduction after a major surgery in the abdomen is with movement. So as tolerated or as able, any sort of movement that we can do can help move the fluid, pump the fluid out of that area. We know that the muscles act as a pump to the system. So anytime you're moving, that can pump and squeeze around the lymphatic valves and vessels that will help push fluid up and out of an area. We think about if we sit too long or don't move, our feet, our ankles swell up. It's the same concept. We want to make sure that we're moving to get things flowing. So wearing the compression garments or compression shorts, I should say, and doing the movement at the same time, that's going to be the best option. But any sort of movement is better than nothing. And so take little bouts, take little breaks, but trying to get short little movements in throughout the day, again, as tolerated, can really help speed up that process. And the last way to help decrease swelling in the abdomen after a liposuction or a tummy tuck type of surgery is with lymphatic drainage or lymphatic massage. And like I mentioned before, I have created that other video on lymphatic drainage or lymphatic massage that someone can follow along with, that's made specifically for after this type of surgery. But this is going to help move that fluid from that congested area and guide it out, again, just to make sure we're getting things flowing out of the area so it's not so backed up and swollen. This can really help guide fluid out of an area, which can help decrease the pain and overall just keep things pumping and moving so they can heal a little bit quicker. So those are the 4 main ways to help decrease swelling after liposuction or a tummy tuck or abdominal surgery. Like I mentioned before, just make sure that you always check with your surgeon before starting any of this, because you want to make sure that it is safe for you after a surgery. Otherwise, I hope you all found this video helpful, and I'll see you all next week for another video. Thanks everyone.